Good afternoon, everybody, and welcome to today's public hearing and stakeholder meeting today, Wednesday, the 30th of June. Before we get started, a couple of housekeeping items that I'd like to go over with you. Please mute your microphone to eliminate any background noise. Attendance for today's meeting is being recorded in the chat box. Please enter your name and organization that you represent. Lastly, we want to hear from you. Should you have any questions or comments, please enter those questions or comments into the chat box. There are staff monitoring the chat box throughout today's meeting. Time designated at the end of the meeting today for any questions or things that you would like to share.
Okay, I'll call.
I'm Marie Timpano. I am the Executive Director of the Cornerstone County. I am also the co-chair of the Beaver County Systems of Care Steering Committee. I'm honored to be here today to facilitate the meeting. It's an exciting time to gather information as the county plans for what's coming ahead. The purpose of the Beaver County Systems of Care Steering Committee is comprised of behavioral health, physical health, drug and alcohol providers, youth and young adult providers, managed care organizations, advocates, individuals with lived experience, and families. The county planning team and the System of Care Steering Committee work closely together on the development of a countywide plan and discuss the expenditure of funds. Historically, the System of Care meetings have been held quarterly. During the pandemic, during COVID-19, meetings were temporarily placed on hold, but are now being held virtually. The next meeting is scheduled for August 24th, 2021 at 1:30. Today, we are gathered virtually for the annual Human Services public hearing. They are being held virtually again this year out of an abundance of caution to abide by COVID-19 safety protocols. Here is your agenda for the afternoon. The purpose of today's meeting is to obtain updates from Human Services departments, to gather feedback and input from all of you, and to inform future planning and development of services within the county. Before we get started, I would like to introduce and recognize some of our county leadership. First of all, I want to acknowledge our county commissioners, Chairperson Daniel C. Camp, Commissioner Tony Amadeo, and Commissioner Jack Manning. In addition, there are several leaders here from the Human Services departments within the county. Mr. Gerard Mike, Beaver County Behavioral Health, Marlene Landrum, Beaver County Community Development, and from our Office on Aging, Linda Hall and Angela Gentile is here as well. Thank you to all of you for being here. Thanks for all of you who are joining us virtually. Thanks for all of the leadership. It's going to be an exciting day today and lots of important things shared and gathered. We appreciate your willingness to participate and share your thoughts. I'd like to introduce Alicia Majors. Let me flip my page here. Alicia is the Beaver County Behavioral Health Mental Health Specialist, and she's going to provide an update on recovery and resiliency during COVID-19. Alicia?
All right, thank you, Marie.
Thank you.
When you think about the word resiliency and its meaning, the ability to recover quickly from difficulty, I instantly think about Beaver County and what we persevered through and accomplished over this past year and a half. Our community demonstrated resiliency by pulling together more than ever to adapt, collaborate, and innovate ways to stay connected and support one another. Providers, advocates, individuals, families, and neighbors all found really creative ways to be there for one another and support one another, reinforcing that role that we all play in our system of care. I now just want to take a minute to highlight a few of the amazing and innovative ways we stayed connected and continued to deliver services and support. Beaver County providers, including all levels of care and services, maintained services during these very critical times. Basically overnight, our providers had to switch to delivering services through telehealth platforms and did so almost seamlessly. Through reinvestment funding and community collaboration, crucial PPE and cleaning supplies were distributed throughout the community. Coalition meetings, workforce groups, task force, and other collaborative meetings switched to virtual platforms to continue planning and working on improving our system of care. Food distribution sites, meal deliveries were held to make sure that everyone got the food and the supplies that they needed. Vaccination clinics were held by various providers and system of care partners to ensure that anyone who wanted a vaccine was able to access one. These are only a few of the ways that Beaver County demonstrated resiliency through the past year and a half. In a few minutes, we're going to hear from the department heads who are going to give us a more of a detailed overview of all of their accomplishments. For all of these things, we simply just want to say thank you. Thank you for your ongoing dedication and commitment to this community. All of your efforts are noticed and appreciated. Next up, we will be sharing a couple short videos. The first one is a video showcasing all of the things that we were able to accomplish during the month of May, Mental Health Awareness Month, followed by a video showing some details about our Deermind grant and our reentry programs. The last video we will be showing is Patrick Young, who is a Beaver County detective and also the commander of the Beaver County ESU team, Emergency Services Unit. And he will be giving some updates regarding the collaboration of behavioral health and the law enforcement. So sit back and enjoy these videos. Thank you.
The Deermind Project is a grant-funded effort to identify and treat young people with symptoms of serious mental illness. It is important that we identify these symptoms because they may mean that the student is at risk for psychosis. We are currently in the third year of the grant. Beaver County is one of only 22 grantees in the entire United States. In the first 2 years of the grant, we have screened 350 students and enrolled 22 to receive treatment services. Psychosis is a serious mental illness that, if left untreated, can cause long-term disability. Research shows that half of all mental illness starts before the age of 14. We've had a few participants in the Deermind program who are less than 12. 37% of students with serious mental illness leave school before graduating. In order to decrease the number of dropouts and to lessen the disability that psychotic symptoms can cause, we want to find these kids early and get them the services they need. Essentially, early treatment leads to better outcomes. The sooner a child with serious mental illness gets treatment, the less the child will be impacted by potential disabilities. Early treatment helps them keep up with their education and prevents possible relapses. Deermind partner agencies work together to help participants remain in treatment. Educational and vocational services, as well as therapy and psychiatry, are all involved. Early treatment also means fewer delays in educational and social growth. Deermind connects students and their families with a range of treatment services to support recovery. Services are provided in the community, home, and school, whatever fits the family's needs. Family support helps the parent or guardian cope with symptoms and learn more about treatment. Deermind therapists and our treatment team have received specialized training in order to treat serious symptoms. Referrals for Deermind can be made through the student assistance team at a child's school or by filling out our online screening quiz. To learn more about the Deermind program and to view the screening quiz, visit www.deermind.org.
What reentry means to me is ensuring a successful transition to the community with the hope that they don't return.
Reentry to me is all about teamwork. We all have to work together to help everybody get out of here and hopefully not come back.
Resources in place for them, reconnecting them to the resource that will help them to be successful as they're coming back into the communities.
And providing housing support, job training support, or any needs that they might have.
To be able to help them to turn things around so that that they're more equipped to go out, that they're coming out better people than when they went in, and hopefully they won't make those same mistakes again.
My name is Detective Patrick Young. I work as a detective with the Beaver County District Attorney's Office. I'm also proud to be the commander of the Emergency Services Unit, the SWAT team for Beaver County. Having behavioral health on our staff as part of our crisis negotiator team has truly been a game changer in the way we conduct our operations within the county. It's incredibly important to have subject matter experts on site in things like just navigating the mental health system today. Dealing with those in crisis is not only a law enforcement problem, but it's a community problem. It's truly important to bring balance for the needs of not only the safety of the public, but those who are behavioral compromised. I'm proud to be part of this collaborative effort and look forward to the future of working with Beaver County Mental Health.
We will be getting an update from Beaver County Behavioral Health from Mr. Gerard Mike. The Office on Aging, Ms. Angela Gentile will be providing that, and Community Development, Marlene Landrum and Dina Cibatoni will be providing that. So first up, I'm going to hand it over to Mr. Gerard Mike.
Thanks, Alicia, very much. The staff did a great job of pulling together several pages of initiatives, priorities, for Beaver County Behavioral Health So, and before I get to that, I want to go over a little bit of the beginnings of the Human Services Block Grant. But so I'm going to ask Alicia and Kate to help me out with those when we do. Too much for me to put, to talk about by myself. But I didn't do this at the first public hearing, and I had a couple of questions afterward. And I thought, I probably should just do it. This is the background of the Human Services Block Grant. It came about in I think I'm correct on the dates, 2012, 2013 is when the Human Services Block Grant was initiated. And it was initiated with, by application, 20 counties. And Beaver County was one of the first 20 counties who participated in the Human Services Block Grant. It was something we did want, and I'll go into a little bit about that. But even prior to the block grant, we had our funding streams, and Beaver County Behavioral Health has multiple funding streams, MH, drug and alcohol, our Health Choices program. We have multiple funding streams here. But if we don't spend those monies went back to the state. It's carryover is what they went. So there wasn't a lot of flexibility between those categories. What the block grant did was give us some flexibility. In the Human Services Block Grant, these are the categories that are there. It's our mental health base funds, which is for Beaver County Behavioral Health, it's our most flexible dollars. The Community Hospital Integrated Project Program, our CHIP dollars, which are the dollars that we receive when we close a bed at the state hospital. We receive in the county to develop diversion options to keep folks out of the state hospital. In our intellectual disability base funds, our flexible funds for the folks with developmental needs. Our Drug and Alcohol Behavioral Health Services Initiative, BHSI Act 152, which is non-hospital detox and rehab. That's part of the block grant. Homeless assistance, which falls under Marlene, is part of the block grant. And that's never been the case where we went across agencies that way. Human Services Development Fund, which is funding for low-income adults. It's a small budget that always came to BCBH. And it early on in the first 2 or 3 years of the block grant, Children and Youth Special Grants was part of it, but then that got pulled back. So they're no longer part of the Human Services Block Grant funding, one of those funding streams in there. However, children and youth is an important part of the planning in terms of Human Services Block Grant. We have so many shared consumers. And that's the whole, the biggest benefit of the block grant, it's the flexibility to serve individuals where they present. We all know that there are very few MH only, drug and alcohol only, HAP only, consumers. They cross funding streams. This just gives us the opportunity to serve them where they present. If they serve in drug and alcohol, if they start there, we can serve them there. We can also make sure that we can get mental health dollars to them, or move those dollars to that funding stream if we needed to, if the majority of folks or a large number of individuals show up in that category. So it gives us a lot of flexibility. It's a real true no wrong door approach to service. So that's really the biggest benefit of the Human Services Block Grant. The other thing is that again, we can move monies around. You have to adequately fund the category that it was initially, that the legislators where legislators placed those dollars. That has to be adequately funded. But if you're realizing, at every given year, I'm not using a lot of dollars in drug and alcohol, or in MH, or in HAP, those dollars could be moved to another funding category. I don't have to return them to the state. And if we manage them well, and there are some dollars left over, we're allowed up to 5% retained revenue, so that we can keep those, again, with approval, state approval on the spending of those dollars. But it allows us to develop some special projects, which we've been able to do with that. And every year we've had varying amounts. The maximum is about $500,000 that we can have in retained revenue in any given year. And we've had anything from close to zero, almost up to that $500,000 mark. It was also the reason with the development of the Human Services Block Grant, is the reason we have 2 public hearings. That came as a requirement of the block grant. It used to be just 1. So that's why we do have 2 of them. But that's the background. And, the flexibility, we have 100% flexibility right now where we can move. There's no cap on the amount of dollars, the dollar amount that we can move between categories. In year 1 of the block grant, it was like a 20%, you can move 20%. In year 2, it's 25%, then 50%, then 75%. After year 5, it was 100% flexibility. And so this is part of that planning process. Every year, an input from the community, from all our community partners into that block grant, planning and spending. And that's how we spend our dollars. When we receive the block grant money, the majority of those dollars are dollars that were traditionally money that came to Beaver County Behavioral Health. So these dollars still do come here, but just to reassure all the partners who are part of this, at one time, it is community development. It was children and youth at one time. To reassure them that no one's taking that money. That money comes out and it goes into those budgets, into the budgets that it traditionally went to, but it's spent according to our individual and collaborative plans. And so there's no surprises. Everyone knows where the money's going, how it was going to be spent. Everybody had input into that, and that's what today's about. So that's a little bit about the background of the block grant. It is something that we want to continue, and we keep advocating for it. And the reason we keep advocating for it is because not every county in Pennsylvania is a block grant county. It's still by choice. A county can choose to become. There's still an application process, but a county can choose to be part of the block grant. It does benefit us in terms of dollars, in terms of planning, where that individual first presents, how we might serve them. So I think there are great benefits to it. So we keep advocating for it until all counties are in it. When all counties are not in it, there's always that question, will it become at risk at some point in the future? And the counties that aren't in it, the majority are. At this point, I believe there are just a few joinder counties who are not in it, and they're trying to figure out how that money is best spent and utilized between multiple counties. So it's more of a funding issue for them than it is anything else. But the concept they agree with. So, okay, with that, I'll take a quick break and I'll let Alicia talk about the Zero Suicide Initiative, or MH Zero Suicide Initiative.
All right, thanks, Gerard. The Zero Suicide Initiative continues to be a focus and priority here in Beaver County. The Beaver County Zero Suicide Team Leaders Work Group, which is comprised of over 40 cross-system partners and organizations, meet monthly to increase suicide awareness and prevention efforts here in Beaver County. Since its inception, our task force has been primarily focused on increasing suicide awareness here in the county. To achieve this, we have been conducting various trainings, developing and distributing educational materials, and creating a webpage on our System of Care website. Some of the trainings that we are offering are mental health first aid, QPR, which stands for Question, Persuade, and Refer, Talk Saves Lives, Suicide Prevention in the Workplace, and screening of Kevin Hines' film, Suicide: The Ripple Effect. For more information about any of these trainings or to register for an upcoming one, you can visit our System of Care website to get that additional information. In an effort to increase awareness and educate the community, we developed and distributed this 4x6 resource card. I realize it is probably very, very small on your screen right now. But on the front, it says, it's okay to not be okay. And then on the back, it provides the warning signs of suicide in the 24/7 local and national hotlines for help. I am happy to report that since September of 2020, we have distributed nearly 20,000 of these resource cards throughout Beaver County. These cards have been distributed at provider offices, at churches, at schools, at food pantries, restaurants, takeout shops, you name it. We have been working really hard to get these out all throughout the county. Also during the month of May, we held a yard sign campaign We distributed over 800 yard signs, throughout Beaver County. The yard signs were designed by Beaver County residents and youth. They did an absolutely amazing job. The yard signs provided inspirational messaging and information about crisis resources. If anybody is interested in additional information about the Zero Suicide Initiative, or if you would like to join our task force, you can feel free to reach out to me. I'll have somebody place my information in the chat box for me, or you can call Beaver County Behavioral Health and ask for me, and I'd be happy to answer any questions you may have. Thank you.
Great, thanks, Alicia. And I have to mention the event in May. I think it was early May. The Beaver County Board of Commissioners offered a proclamation designating May as Mental Health Awareness Month. At that meeting, a fairly large group of our Youth Ambassador program attended and participated in that. So we appreciate the Board of Commissioners doing this. We also appreciate their meeting with our the Youth Ambassador program youth who were at that meeting outside on the steps of the courthouse, answering questions and actually asking them questions. This is a real dynamic group of individuals and you know, I've been in this system for 35 years, too long, but for 35 years. But I have to say, in all that 35 years, I mean, stigma is a huge, huge issue. It remains an issue, but I really feel for the first time it's really being impacted, and it's being done by our Youth Ambassador program. Mm-hmm. And they're doing it, I mean, really from the ground up. They're going into the elementary schools and you know, kindergarten, first grade, and doing a lot of talk about, you know, anti-stigma, you know, suicide prevention, acceptance for anyone with behavioral health needs. So they've been doing a remarkable job.
Yes, they have.
Okay. And then I'm going to jump to, you saw in the little video clip, the collaboration with law enforcement and criminal justice. And if Danielle were here, I'd have her do that, because Danielle really, Alicia, Jack, a lot of our staff put a lot of effort into, and a lot of time outside of the office working with the emergency services unit, you know, as crisis negotiators on site as crises happen in the community. So, and that's just been invaluable. I have to also, with that, credit our district attorney, David Lozier, in his partnering with us and all that he's done to encourage, and this is our whole goal of these relationships, to encourage services over incarceration. And he has a number of programs, and Kate may talk about some of those when she talks about the drug and alcohol, because that's where a lot of them grew out of. So I won't go into a lot of detail with that. But those partnerships, they have, again, strengthened our relationships with our first responders, who are comfortable now reaching out to behavioral health staff when they identify an individual who may be in need of treatment. Again, the whole goal from our office, the courts, the district attorney's office, public defender's office, Beaver County as a whole bought into services over incarceration. So, I mean, in that partnerships, it just keeps getting stronger and stronger with our relationships and with our crisis teams and our crisis negotiators going out with them. There were 2 lunch and learns in coordination with the Bar Association to educate attorneys, judges, and magistrates on a diversion program in Veterans Court, and it was another one that focused on behavioral health laws relating to justice system and resources that are available. Behavioral health is partnered with Police Academy to co-facilitate training such as mental health first aid, naloxone training, and trauma-informed care. De-escalation training is also being added to the list of trainings for co-facilitators. By partnering with law enforcement, we are in the process of developing an officer wellness program, and some components of the program focus on peer support, physical health, and stress management. In terms of service development, the Office of Mental Health and Substance Abuse Services has offered additional funding to develop and expand crisis services by adding peers to both crisis providers. Beaver County Behavioral Health is working with the Mental Health Association to develop transportation options for consumers. And Heritage Valley Staunton Clinic has begun having a peer go to the inpatient unit twice a week for support and for those who may need it, just that peer-to-peer interaction. So those are just some of the things and some of the priorities that we've been focusing on. And with that, Kate, I'm going to have you talk about, Kate is our single county authority with Beaver County Behavioral Health, is going to talk about some of what we're doing there.
Thank you, Gerard. Good afternoon, everybody, and thank you so much for your time and attention today. It is so nice to be here in person with our team, and we look forward to hopefully soon literally seeing all of you in person as well. So thank you for being here today. It's no secret that throughout the past year, because of the complications of COVID, it was a very challenging year when it comes to service delivery. But as Gerard and many others have said today, we tried as best we could to do business as usual, albeit with a different type of service delivery. But we did work really hard to make sure that persons suffering with substance use disorder and their family members continued to receive the support that they needed, especially during our pandemic, when isolation can be very, very difficult for so many people. So what we did throughout the past year through our funding from the Department of Drug and Alcohol Programs is we maintained a very vigilant watch on all of our clients coming to us for service, but especially those with opioid use disorder who are at the greatest risk for overdose and death. And so we did not want to lose sight of anybody, but especially those individuals throughout the past year. So we expanded our services with our funding to include additional availability of the 3 FDA-approved drugs used to support treatment for those with opioid use disorder, and that would be methadone, Vivitrol, and Suboxone. And so now anybody who is coming to Beaver County Behavioral Health requesting services for opioid use disorder, if they meet the medical necessity criteria, and if we have the funding available, we are able to assist them to receive those medications in addition, in conjunction with licensed treatment for their opioid use disorder. And so we want to get more supports out there through medication-assisted treatment, and that was an initiative that we did accomplish this past year. We also were able to add an additional case manager to our drug and alcohol unit, and this person is deployed now to the Beaver County courts to be on site to provide real-time level of care assessments to people who are coming into the courts and who have a history of substance use disorder that may be related to some of the reason why they are in the court. So we wanted to provide additional support to our courts and also to the Beaver County Jail. So we were able to expand our complement of case management throughout this year. And I can't say enough about the hard work of our staff here who were able to make that happen, especially in the middle of a pandemic where we were all working in non-traditional settings. So we are happy that we were able to provide that service. We continue to track on an annual basis the overdose death data of our Beaver County residents. And again, I can't say enough about the hard work of our Beaver County Coroner, Dave Gabauer, and also our Beaver County District Attorney, David Lozier. We work collaboratively to try to track in real time the number of lives that we lose each month to accidental overdose. So throughout 2020, we lost 62 lives to accidental overdose. I will never be happy until that number is 0. But despite what's going on at the national level, here in Beaver County, although we did see a very concentrated spike of overdose deaths and overdose activity in the second quarter of 2020, which would have been April, May, and June, by year's end, we've closed out the year at 62 deaths, which was one higher than 2019. And I don't say that lightly. As I said, I'm not happy with any loss of life ever. But we did try to stay very aggressive throughout the year, especially considering that people did not have physical access to their recovery supports or to their natural supports. And for a while, as we were transitioning to a remote platform, even some of our residential programs, because of COVID protocols, had to diminish their capacity. So it was a little bit of a juggling act to get people into the levels of care that they needed at the onset of the pandemic, which is why we got very aggressive and continued to do outreach to those at risk for overdose. We also continued to provide virtual Narcan trainings and Narcan distributions throughout the year, and we continue to do so. So for anybody in the county who would ever be in need of Narcan, which is the antidote to an opioid overdose, it can reverse the effects of that overdose, please do not hesitate to contact me. And again, if the magical powers behind behind the screen can put my contact information in the chat, I would be happy to get you the Narcan that you need and also to provide training if you so desire. We also were able to partner with the Cornerstone of Beaver County throughout this past year. We received additional funding to provide housing supports for persons with opioid use disorder or stimulant use disorder. And we're partnering with the Cornerstone of Beaver County to provide up to 6 months worth of rental assistance. And also the funding can be used to remove obstacles to people seeking safe and affordable, secure, permanent housing. So for example, if people have arrearages from utilities or even court fines, this special initiative money can help us to provide some financial relief so that the people can enter into housing that suits their needs. And we can also provide startup costs or startup services for furniture, for utilities, for anything that will help to support their recovery through safe housing. So that's been a wonderful partnership that we have forged throughout the past year. We also continue our partnership with the Beaver County Jail and with Heritage Valley Healthcare System, again, with a primary focus on overdose survivors. So through both the jail and Heritage Valley, we provide Narcan to those entities, and they will provide Narcan upon release from the jail to people who are incarcerated, who have opioid use disorder. But they're also mailing out Narcan to the family members and the emergency contacts of those people who are incarcerated, so that we're sure that there is also some support to those families upon the person's release and reentry into the community. And the same with Heritage Valley. They are, for everybody who's coming into the emergency department in the state of overdose, Heritage will link them to our office or to a treatment provider for continued follow-up, but they also have Narcan available on site now through our office that they give to their patients upon discharge. Two more things. Our 5-year federal drug-free communities grant is about to expire, and we have recently applied for continuation funding for another 5 years of that project. And the target population is Aliquippa School District and community. And we are hoping that we will be receiving a continuation of that award to provide some curriculum-based programming in the schools and also some community supports to the Aliquippa School District and community. The last thing is we continue to work closely with local magistrates and police departments for our community-based diversion program for people who have substance use disorder. And we are happy to say that we are partnering now with the Ambridge Police Department, who hopes to develop their program by the fall and expand services at that end of the county as well. So that's about all that I have. And again, thank you so much for your time and your attention.
Thanks, Kate. And I promise we're about done. I'm just going to do a couple of comments on See, that's why I needed help. Now you know why I need help. Just a little bit about intellectual disabilities and autism, which is the focus of the Office of Developmental Program, and therefore the counties. And the guiding principle, the guidelines for individuals with intellectual disability and autism is a document called Everyday Lives. And it just as it's titled, it is, the goal is to achieve an everyday life for all individuals. There was a conference held this 2021, and it was held over a 5-week period, May and June of this year. And it focused on these 5 topic areas: racial equity, community of practice for supporting families, regional collaborative, technology, innovation, dual diagnosis, and employment. The new edition of the Everyday Lives document is out and available. It's published every 5 years with updated information to guide individuals, families, and providers through the support system. It also mentioned there's a group, it's the ISAC, the Information and Sharing Advisory Committee, which is it's moved to add a 14th recommendation to its document to promote racial equity, similar to the Everyday Lives, or in concert with Everyday Lives. And the overall theme there is that communities are richer, more just, and stronger when we honor and respect the whole of racial diversity. The Everyday Lives document has really contains 2 core values of recommendations that have stayed true since 1991. And that first one is that we value what is important to people with disabilities and their families who are striving for an everyday life. And the second one being that individuals with disabilities have a right to an everyday life, a life that is no different than any other citizen. Kristen Ahrens made a little, basically she echoed a little comment, a couple of lines that were first, I guess, presented by an individual by the name of John McKnight as we approached the 30th anniversary of Everyday Lives, but this is something he had said at the first Everyday Lives, in the first Everyday Lives publication. And that's that, and it stays true today. Our goal should be clear. We are seeking nothing less than a life surrounded by the richness and diversity of community, a collective life, a common life, and everyday life, a powerful life that gains its joys from the creativity and connectiveness that comes when we join an association as citizens to create an inclusive world. Everyday Lives guides us in our commitment to help create just that world. So with that, I should also mention just real quick, incident management. That's also a big priority. In that Pennsylvania continues to be in the counties, therefore, continue to be in the forefront of incident management and take pride with continuing to ensure that incident management policies and procedures reflect new and innovative approach to protect and promote health, safety, and the rights of all individuals. So with that, I'm going to stop, and I think we pass the baton to Angela, correct?
Yes.
All right,
Okay.
here we go.
Hello, everybody. I'm Angela Gentile with the Beaver County Office on Aging, and I'm presenting today for Administrator Linda Hall. We're going to be presenting our priorities that we've done the past year. One is to provide access and information by our information and referral staff, the Day at the Mall program, and care managers. And of course, as a result of the 2020 pandemic, our office was open, we were offering services, but the doors were closed to the public of our office. So of course, as everyone else, we had to handle things differently. We get hundreds of information and referral calls in each month with people asking questions about everything imaginable about older adults. So all of that was done over the telephone, as well as our Apprise Health Insurance Counseling Program, where our staff assist people, helping them understand or enroll in Medicare, medical assistance, HMO plans, supplemental plans, prescription coverage. Many times this is difficult and people come into our office and rely on us to help them sort through that. We print out papers and we had to provide that all on the phone. It was a challenge, but they did that and they got people the assistance that they needed. Our Day at the Mall event is held 10 times a year at the Beaver Valley Mall, sometimes in the hallway and many times inside our center at the mall, our senior center in the Rural King corridor of the mall. And it's a little mini vendor fair to help educate older adults about programs and services available to older adults. But of course, there's an entertainment component and refreshment component. Since we weren't able to help educate people in person, which they like to do and talk to individuals, we had 3 drive-by Day at the Mall bag distributions at the Beaver Valley Mall. So we had where people could come, get a bag of info. It had a bunch of goodies, but it also had a lot of literature to educate them about things that are available. And our care managers who provide in-home services for people, all of their assessments were conducted over the telephone. Normally, the Pennsylvania Department of Aging mandates in-person, face-to-face assessments. All of that was done by telephone to get them set up with services that they need. Well, we had a 4-year area plan community survey in 2020. We are mandated once every 4 years by the Pennsylvania Department of Aging to survey the community to find out what the community thinks that older adults will need in the next 4 years. So normally, we do get the survey online with SurveyMonkey, but many older adults, even those who use electronics and computers, they refuse to fill out the survey online and they want a paper survey. So we were in a bit of dilemma. So at first, we pushed out emails with our survey link to social service agencies. And I want to thank many of you. You got that survey. Many of you filled it out and you pushed it forward to all of your email contacts. And you did a great job. And we noticed right away with our survey, we've had lots of responses from people aged 59 and under, and maybe the youngest is the 60-year-old group. We weren't reaching our older adults. So we had to refigure out what to do. So we had some of our agency staff call our care management clients. We had our senior centers call all of the senior center participants, and the retired and senior volunteer program even volunteered to call their people who don't have computer access and ask them the questions of the survey online. And I'm happy to report that we reached 1,229 people. That was an increase of 136 over the 2016 survey. We were very happy. We had responses from every Beaver County municipality, but 2 of our smallest communities. So here's the results. Of the Office on Aging services, the most needed services people believe that older adults are going to need are housekeeping and laundry, grocery shopping and errands, meals delivered to the home, transportation, and showering and bathing assistance. Now, of course, we don't get funding to offer everything that people need, but there are services that people are telling us that we don't fund, but there's a big need for them. And those are grass cutting and snow removal, help with odd jobs around the house, helping to learn how to use a smartphone, tablet, and computer. And most older adults thought they knew how to use them well until the pandemic, and the survey results, the written results were showing that they needed some help learning some more features of their smartphones and computers. Also, they need help with grab bars, handrails, and stair lifts for the home, funding for that and installation, and help paying for eyeglasses, hearing aids, and dental. We discovered a trend through our survey. People age under 60, they want to learn about us either by calling us on the phone or they want to learn online. People age 60 and over, they either want to call us on the telephone or they want printed publications to learn how to read about agency services. So that was an interesting trend. We enhanced technology. We have been starting to do mobile assessments, and that was very important during the pandemic. We took our Service Pros home when we worked remotely, and so we were able to complete all those assessments over the telephone, and they were entered immediately and right away into the computer system. When we went home at first, we went on through a server connection to get connectivity, and the server was a little old, so we found it was time to get a little bit updated equipment. So we got what's known as a VPN, a virtual private network, to establish protected network connection for privacy. And we got all our staff agency iPhones with hotspot availability. So we always had an internet connection. And this was especially good. We had several caseworkers who were maybe in remote areas and had some spotty home internet connections at times. Through the Human Service Development Funds, we acquired iPads and trainings for isolated older adults to get some iPads. So we found some people who had an interest in learning how to use an iPad, maybe had a little bit of family help involved, and we wanted them to be able, or prevent isolation, them to be able to FaceTime with family, play games, and use other functions of the equipment. Our case aides have been working with the older adults. They're finding it's being very time consuming because maybe things as professionals, we sort of figure out it. They have a lot more questions about a lot of the functions. And for a short period of time, we were very fortunate to have the Slippery Rock University students to call seniors and work on training with them. And because so many people are saying they want to learn about us online, we have increased our presence on our website page, our web page of the county website, through the county social media and our YouTube channel. So we work harder to get more of our flyers on our page of the county website about things that are coming up, as well as the county Facebook and Twitter pages. We have placed our Beaver County Senior Resource Guide on the our web page, so that's available. And we have an agency YouTube channel, and we interview different workers in our agencies about our different services, and we put that online. So people have that available when they're starting to look into things for their loved ones or neighbors, that they could take some time and learn about the different things. And because people like, the older adults still like the printed word, we increased the amount of pages that we pay for the Office on Aging section in the Beaver County Senior News. That's a quarterly news magazine that comes out, and we put in all kinds of information about our services and programs. It's published 4 times a year and is available for pickup at various locations throughout Beaver County. It's also available online, should they not be available. We advocate and protect for our older adults by preventing abuse, neglect, exploitation, and abandonment through our older adult protective services. And this service has been contracted out, and as of today, it's been brought into our agency to be handled in-house. We contracted out that service previously for 30 years. We offer caregiver support program and webinars to educate consumers and families on caregiving. The program was designed to reduce caregiver stress and respond to the needs of caregivers of older adults, individuals with dementia, as well as grandparents and other relatives aged 55 and older who are raising children or grandchildren under 18. The caregiver does not get paid through the program, but can receive reimbursement for pre-approved out-of-pocket expenses and services and supplies. This program has had numerous billboards throughout Beaver County. You may have seen them through 2020. Many of them are up still to this day, advertising the program. We've done a lot of radio ads, church bulletin ads, and restaurant placement advertising, so people know about the program. And we recently just ran 3 webinars for the program on senior resilience for daily life crisis during the pandemic and isolation, grandparents raising grandchildren, care for the caregiver, using self-care to combat compassion fatigue. Our ombudsman program has been available since the pandemic, and now to advocate for people living in nursing homes and personal care homes and other long-term services about situations that affect their health, safety, welfare, and rights. That was so important during the pandemic, because probably as many of you know, no one was able to get into these facilities. So if people had issues, they could call us, and the ombudsman through the telephone during the pandemic was able to help mediate solutions. Again, you'll see our ombudsman billboards throughout Beaver County promoting the program, and we've had many radio ads also, so people know the service is available. Our Apprise Health Insurance Counseling Program, the name is being rebranded by the Pennsylvania Department of Aging to be Pennsylvania Medicare Education and Decision Insight, or PA-MEDI. So again, I mentioned earlier that they help people with, either changing or things getting set up with Medicare, medical assistance, HMO, supplements, prescription coverage. And hundreds of people reach out to us each year for this assistance. We were mandated last fiscal year by the Pennsylvania Department of Aging Health and Wellness Program to run a chronic disease self-management program. But because of the pandemic, we weren't able to get a provider to do that. So we had a year reprieve, and I'm happy to announce that our senior center provider, Center at the Mall, has agreed to offer this program. 2 of their staff was just trained virtually, completing the online training, and hopefully soon they plan on offering this program in person for older adults. We have health, wellness, and nutrition programs, and this has been being provided by our senior centers. And in Beaver County during the pandemic, we chose to keep our senior center staff working. Many counties did not have their senior center staff working, but we felt due to the isolation that we were seeing, it was important to have them doing many projects for us, again, to prevent the isolation. We had them making wellness calls to their senior center participants, making telephone reassurance calls for people who needed a bit more attention. They were offering grab-and-go meals to older adults who needed them. So Center at the Mall and Circle Friends Baden and New Brighton offered this. And this was the first time the Pennsylvania Department of Aging ever let senior center meals leave the senior center without being consumed at the center. COVID funds were made available early during the pandemic, and our agency was able to get Center at the Mall a walk-in freezer, which helped out with the expansion of this grab-and-go program. We had the centers help us with our several drive-by bag distributions for Day at the Mall, Halloween, Thanksgiving, Veterans Day. We had cleaning supply bucket distributions, personal care home, bag distribution, winter weather box, and spring weather box distributions. Our Circle Friends Center is helping us distribute the senior farmers market vouchers. Normally, those are distributed in person. The Pennsylvania Department of Agriculture said they could be handled by mail this year. And we had our centers increase their presence on Facebook with programs available on tech tips on the computer, cooking videos, exercise videos. And Center at the Mall ran a walking program during the pandemic that they met in Beaver to get out and walk. We're happy to announce our senior centers are going to be open back up. People have been begging us to open. Our Center at the Mall at the Beaver Valley Mall, the fitness center, opened June 1st. They increased their hours from 8 a.m. to 2 p.m. on Monday, Tuesday, Thursday, Friday. The fitness classes there start at the 3rd week of June, are going very well. And Center at the Mall is reopening July 6th. They could enter in the front door for the first time in a long time. And they'll be open for activities and lunch. And of course, reservations are needed for lunch. Our Circle Friends Centers in Baden and New Brighton will reopen July 6th for an activity and meal. They'll be open from about 9:30 to 1 Monday through Friday. Of course, reservations are needed for the meal. I think I forgot to mention Center at the Mall is going to be open Monday through Friday. They're not open Wednesday, July 7th, but Wednesday, July 14th and on, and they'll be open. And one program we expanded during the pandemic was our Surprises for Shut-ins program. Normally, we service up to 500 people a year with this program. which provides a bag of gifts and a friendly visit to isolated older adults living in their homes and apartments all throughout the county. Our administrator felt so many people were getting isolated, we're going to increase it to 1,000. So we had our senior centers help us. We ordered items. The public donates gifts, and we have the public help us wrap gifts, and we have a core volunteer that delivers gifts, but we just put the gifts in bags, and our senior center staff and our agency staff helped deliver it. And we provided some gifts to some people that maybe we wouldn't have done normally. They were maybe not as homebound, but they were just isolated. And it was kind of cool. One lady told me it was the only gift she got. She wasn't able to see family and all. So in those bags, we included a lot of literature, especially our agents, the senior resource guide. It was interesting to hear from the seniors who normally didn't get a bag. They really appreciated reading up on all the services available. So it's been a busy year for us, but it was rewarding that we were able to help a lot of people. So next, I'm going to turn it over to Beaver County Community Development, to Marlene Landrum and Dina Cipollone.
Thank you, Angela. Thank you, everyone, for giving me the opportunity to speak about what we do, community development. I'm Marlene Landrum, the Director of Community Development. And, excuse me, right before my turn to come up, I got a frog in my throat, so if you'll bear with me. As happened with most other agencies and organizations in Beaver County, the pandemic dramatically changed or altered the way we provided our services. In many ways, it added many programs and new responsibilities to those people in our department. So as you can imagine, the pandemic exacerbated the housing instability, food instability, and homelessness in Beaver County, and impacted the way community development addressed the issue of homelessness in our communities. Excuse me. There are 4 funding streams that are used to administer programs dedicated to addressing homelessness in Beaver County. These include the U.S. Department of Housing and Urban Development, or HUD, the U.S. Department of Veterans Affairs, the Pennsylvania Department of Community and Economic Development, excuse me, and the Pennsylvania Department of Human Services. So the programs that are administered using HUD funding are the Emergency Solutions Grant, which funds the Women's Center, Rapid Rehousing, Hotel Sheltering, the Homeless Hotline, and Beaver County On Call. It also funds Project ID, which helps persons who don't have their IDs to gather the documentation necessary and get their IDs, which will then help them to be able to get employment, which will then also in turn help them to mitigate the homelessness, the homeless situation. We have our Continuum of Care Planning and Homeless Management Information Systems and Collaborative Applicant for All Homeless Continuum of Care Applications. Our Community Development Block Grant Supported Homeless Efforts are street outreach, hotel placement, transportation, gift cards, and restaurant cards to help people during this difficult homeless time. Excuse me. We also, I want to throw in a few things that we did, because during the COVID-19 pandemic, our staff stepped up and took on the challenge, the additional funding. We had to quickly create programs that would be impactful to the community while keeping up with ever-changing guidelines and deadlines and demands. So our organization, I'd like to give them a shout out because they did a really good job doing that. Some of the things we did with our COVID-19 stimulus funding through HUD was provide extra hotel funding, funding to reconfigure shelters to mitigate the spread of COVID. We did a lot of distribution of personal protective equipment and sanitizing and cleaning supplies to various organizations and schools. We provided funding to help distribute prepared meals. We had children's educational and food distribution programs. We provided Chromebooks to low-income students. We helped to coordinate a COVID-19 vaccination program for the homeless and those that provide assistance to the homeless. Some funding that we had was provided for the acquisition and rehabilitation of the new men's shelter that will be opening in early 2022. So funding from our Veterans Affairs assists the homeless veterans and their families. We get funding from the Pennsylvania Department of Community and Economic Development in the form of our Emergency Solutions Grant, which offers assistance to the Women's Center and provides assistance for rapid rehousing services. We also got funding from Pennsylvania DCED for stimulus funds, which went to provide PPE and sanitizing products to schools also and other organizations. We also provided educational services to schools or other organizations that were providing services to children during the hybrid school sessions. Some days the kids were in school, some days they weren't, and we needed organizations that were able to step into that void and be able to provide the services that parents could work. We also provided funding for hotel shelters and landlord-tenant mediation to try and prevent homelessness. We received funding for the Department of Human Services for our homeless assistance program, which provides rental and energy assistance to prevent homelessness. Extra funding was provided for us by Beaver County Behavioral Health, and that was used during the pandemic to supplement programs that mitigate the threat of homelessness. We also received funding to do the Emergency Rental Assistance Program, excuse me, and that is currently ongoing. I want to throw that out there to anyone who might know someone who would be able to avail themselves of this service. It helps renters with their rental arrearages and utility arrearages to prevent evictions and loss of utility services. And applications can be submitted online at www.compass.state.pa.us. I know it's hard, but I'll have this on the Community Development's website, where you can click on a link there, the website from the county webpage. You can click on that to either go to the Compass website and complete an application online. There's also a link you can go there to get a paper application printed out if you wanted to give it to someone who doesn't have internet access. Paper applications can also be picked up at all of the magisterial district judge offices, the Franklin Center in Aliquippa, the cornerstone of Beaver County and Beaver Falls, the Community Development webpage is the website, as I told you, and they're also available at our community development offices. To date, we have paid or obligated over $2 million to help provide individuals and families with this kind of assistance. So please feel free to spread the word or get in touch with me if you have additional questions about how this program can help. It goes on through the end of December, and we have a lot more funding that is available to offer this assistance. So anyway, next, there's a wide spectrum of supportive housing programs to address homelessness in Beaver County, and these programs fall under the Beaver County Continuum of Care, or the COC. The COC is a HUD-recognized local partner networking toward the goal of ending homelessness in Beaver County. The Beaver County COC is made up of approximately 275 individuals and agencies who collaborate on how to best address the complex and unique needs of homeless or near homeless individuals and households. Partners in the continuum of care include persons from housing programs, utility assistance, food security resources, treatment providers, landlords, people with lived experience, education and job training, local government officials, mainstream benefit providers, churches, police and fire departments, legal advocates, and various other social service providers. So these programs consist of 4 emergency shelters, 5 transitional housing programs, 3 permanent supporting housing programs, and 4 rapid rehousing programs. There's a coordinated entry system in place, which utilizes a process to assess and prioritize households with the greatest needs for housing and to point individuals and families toward the most appropriate resources for their particular situation. The Housing and Homeless Coalition is a network of over 200 partners that work collaboratively with a mission to end homelessness in Beaver County. The coalition meets on the second Tuesday of the month, and now I will turn it over to Dina Cibatoni so she can elaborate further about the coalition.
First, I'd like to, I don't know why it took 2 sessions for me to realize, but it's the second Thursday of every month. So the slide is incorrect. If you're putting it in your calendar, please put it in for the second Thursday. We do meet on Zoom, and if you're interested in attending, please email me. My email address is on the slides as well, so I will send you the link. Just a couple things to piggyback on from Marlene's section. With the personal protective equipment and cleaning supplies that the community development utilized some of the funding for, there's still plenty of them available. So please, 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 if you have any need, or if you have the ability to even stockpile some supplies, please contact community development, and we will get those supplies available for you to come pick up. There's masks, little hand sanitizers, gloves, and wipes, I believe. Yes. So the intention was, when the decision was made to obligate the funds to that, was so that agencies could stockpile. At the beginning of the pandemic, we all scrambled to get those supplies, and so we didn't want to find ourselves in that situation again. Unfortunately, with the new variants that we're seeing with COVID, we might continue to have some need for some of those things. So please don't hesitate. There's so many supplies that are like in the hallways and everything. So not only do we need to get them out to folks who need them, but we need to get them out of community development space. So please help us with that. And then also with the ERAP program, Marlene did such a great job describing that. There is some good news. We have another 30 days. The eviction moratorium has been extended another 30 days. So before folks will start getting eviction notices, they can obviously still access the ERAP program and hopefully mitigate that risk. So that has been extended until the end of July. My understanding is the CDC does not intend to extend it again. So that will most likely be the end of it. It also had been challenged in court, and I just read today that the Supreme Court is upholding the moratorium. So that's good news. It does give us more time to get that support out to folks. Otherwise, Marlene did a great job also of describing our programs. On this colorful screen that's up there now, it lists the various programs and the contact information for those. You will notice that some have an asterisk by them, and that indicates that in order to access those, you would have to go through coordinated entry. Coordinated entry is the screening process through which households are assessed for their need and to find the best fit program for them. Through the pandemic, we did update the tool to prioritize folks who are at higher risk of COVID, the higher risk of getting it, and also having more severe symptoms. So those folks are still being prioritized right now to get them quickly housed. We know that housing is a healthcare issue, and so we've done everything we can through the pandemic to expedite that, including the enormous growth of the hotel program, which the Cornerstone managed. And it's just great news that we can say from our last hearing till today that there has been a building purchased by the Cornerstone on behalf of the county to operate a men's shelter. So that will hopefully help the hotel program come down off of some of the steroids it's been on. Just a quick, I won't hold you for too much longer, but just a quick overview. What does homelessness look like in Beaver County? Most folks, when we think of homelessness, we tend to think of what it looks like in cities. And although we have little pockets of that here and there, that's not generally what it looks like in Beaver County. And so just a little bit of data here to explain it to you. We do an annual point-in-time survey, and there's 2 components to it. There's an unsheltered component, and there's the sheltered component. Sheltered are all those programs that were on the colorful slide, all the people who were in those programs. And so they're still considered homeless because they're in a homeless program, but they are sheltered. In our 2021 point-in-time survey, we had 444 people in those programs. For our unsheltered portion of the survey, we encountered one household comprised of 2 people. We know that to not be accurate. In years past, we've had between 6 and 10 people identified in the point in time survey. We were not able to execute the survey as thoroughly as we had previously done. The surveys conducted at the end of January, and at that time, the transmission rate was so high for COVID that we didn't think it was responsible to send outreach teams throughout the county. So we relied on our all of the partners who we've talked about today, all the people who kept offering services, your social services. We depended on you, we depended on the schools, we depended heavily on law enforcement to be our eyes and ears instead. And we also developed a mobile app this year to report folks on, and so to limit the transmission of papers and whatnot. And that worked really well. So interestingly though, we ran the survey to compensate for the fact that we had a less robust outreach effort. We ran the survey for a week. We still only asked about that one point in time, which was January 20th, the night of January 20th, but we surveyed folks for a week. And during that time, we encountered many other households. I should have put that on the slide. There were about, I think, 7 or 8 other households we encountered during that week, who then immediately were put through coordinated entry and had been given connection to housing resources. So we look forward to the 2022 point in time survey to be a little bit more accurate. Another development in the last year was we developed a formal outreach program. It's currently a one-person team, which we hope to enhance, but she's done a really great job of being out in the community. And one of the really exciting developments is she has a satellite office at the Ambridge Police Department. And so she goes there several times in a week and works with the officers to follow up on any cases of homelessness. And she has made really good connections with business owners and the school district and neighbors in Ambridge to identify and connect folks who are unsheltered or in unstable housing. We're looking to expand that model into some other jurisdictions, so we're really excited about that. Prior to that development, we always had volunteer outreach teams, and those are still in place, and they are very committed and do a great job. Unfortunately, in 2020, we had to put a hold on some of those efforts, and so we're looking forward to ramping back up with our volunteer teams as well. The volunteer teams are great because they cover more area in the county, and because they've been doing it for so many years, they are familiar with the areas that they do. And so they know the spots to look and the people who to check in with to get a beat on whether there's homeless folks there. In the last year, we reduced the mean length of homelessness by 11 days. Our average went up, which tells me that we still have some of those outliers who have those extraordinarily long lengths of time homeless. Those are folks who are facing multiple barriers. Those are the folks that that we're working with all the agencies we've discussed today to pull together. As Gerard pointed out, people aren't just homeless, they're homeless. There's often some mental health issues, maybe substance use disorder, and a myriad of other issues that just when we think we've seen it all, something else pops up. And so those are the folks that are still having some longer lengths of time homeless. We also, with the moratorium in place, units aren't turning over as quickly, and it's taking a little bit more time for folks to find a place once they are plugged into a program. But the mean has gone down by 11 days. So overall, we're doing a better job of getting folks housed more quickly. As I said about the hotel program, we housed approximately 210 households in hotels throughout the pandemic. We always aim for less than 30 days, but really in the thick of it, some were staying for a couple months at a time. I keep looking at Marie for her reassurance because she runs that program, her agency runs that program. And the final point here is we grew our racial equity committee. We've had a small devoted committee for the last few years, and in the last year, we really breathed some new life into it. We've dug into our system-wide data, and unfortunately, but not surprisingly, we do have disparities both in how folks come into our continuum of care and also how they exit from it. And so we're looking forward for 2021 on identifying some strategies of what we can do about that. We recognize that some of the underlying issues are systemic and beyond our control, but we're trying to hone in on those things that we do have control over so we can start making some improvements there. We've learned a lot through that process, and so that group is slated to do a training in the fall or maybe early 2022 through BC CAN to share with other agencies how we started that work and how they might be able to start it too. And I think that's everything for me. Thank you for having me.
Thank you, Dina. I think Stephanie's going to go next and give us some update about the survey.
Yes. So in regards to the Human Services Block Grants and System of Care Outreach Survey, it is a survey that we have put out every year. It's mostly electronic now, but it's something that we could provide a paper form if necessary. But it's kind of lengthy, and but it is our survey that gives us answers to different parts of the human services system. What are the strengths, what are the areas of needs in the different domains. The reason that we put out the survey is to gain feedback, and that feedback is used to help guide us and some of the decisions that we make going forward. And a lot of people ask who should complete the survey, and that should be everybody. Anybody in Beaver County is a stakeholder and is somehow impacted by the services that are provided. So we need to hear from everybody what the system strengths and needs are. On the next slide that will be popping up is a link to the survey. So that's a direct link to complete the survey. It takes 8 to 10 minutes to complete the survey online. It is also available on our System of Care website. We have about 47 surveys completed at this point. So we are looking for more surveys to happen. If you know of anybody or haven't taken the time to complete the survey, please go ahead and do that. We have a little bit of time, a couple more weeks, but it takes 8 to 10 minutes to complete, and it does help guide. On the next slide, if you have any questions or comments about the survey or do need that paper copy to complete by hand, you can contact myself or Jack Wallace. And I did also want to say, because I know some people came on a little bit late, if you have not signed in via the chat section on the Zoom, please go ahead and sign in with your name and your affiliation, please.
Wow. I don't know about the rest of you. That was a lot of information. I mean, I guess it's been almost, 18 months ago was when this whole nightmare began with the pandemic, a situation that could have really brought our community to its knees. And thanks to those of you around this table, those of you on the screen, and the leadership and others in our community, both formally and informally, that didn't happen. And so that is incredible and a testament to the compassion and care and commitment to the community, to Beaver County, to its residents. And also opening up an opportunity such as this to provide your input. I have a son with special needs, and so I appreciate the opportunity to share in those experiences and what could benefit him and how we can make it better for all of us. So thank you to all of you for the hard work that you do. We are honored and pleased at the Cornerstone of Beaver County to be a. I think there's an opportunity for some questions. I don't know how we'll know if those questions are there.
Yes, folks can either unmute themselves and ask the question, or they can submit it in the chat box, and Jen or Kim will be able to submit those to us.
A lot of information, so I'm sure there's a lot to think about, but if you have questions. got some great people around the table to provide some insight for you. Well, while we are wrapping up a little bit here again, thank you to all of you for taking the time to join us. Thank you to our county Board of County Commissioners. Thank you to the department heads, Gerard, Marlene, Angela, Sina, and the rest of you, Kate, everybody around this table, again, for participating in today's meeting. Certainly, I appreciate that you can always pick up the phone and reach out to any of the folks in our community to give insight or feedback and ask questions, and so that's also a very nice, opportunity here in Beaver County. Thanks for the opportunity to sort of help to facilitate a little bit. I appreciate. We miss you. It'll be great to see people in person. I, for one, complain a lot about. I talk with my hands, so it's hard for me to do this kind of communication. But you guys were super, and appreciate everybody. Please respond to that survey. It doesn't take a ton of time to respond to it, and it's an opportunity to collect very, very important information from those out there living these experiences and living in our community to share what's working, what's not working, what's there, and what's needed. So we appreciate you. Remember, the next Continuum of Care or Beaver County Systems of Care Steering Committee will be August 24th, 2021 at 1:30. You are certainly all welcome to join that.
Manning here. I did post some. I just want to thank you all collectively and individually for the great work and presentations today. That was a tremendous amount of information, and I can't give you enough of my heartfelt thanks and appreciation for what you guys do every day. Just a tremendous effort, especially during the last year. So just wanted to barge in right now and just say thank you all, and I really appreciated the presentations.
Thank you. Thank you, Commissioner Manning, and thank you for participating.